Mackenzie. I'll be your nurse today. What's your name and date of birth?
Alexandra Wild, 10/24/1964.
Nice to meet you.
Nice to meet you too.
So here you've been having some chest problems or pain. Can you tell me about that?
Yeah, well, last week I was at work and I was working on a really stressful project for my boss. It was due that day, so I was under a lot of stress. I started to feel really dizzy and lightheaded, and I was sweating like crazy. So I just put a wet towel around my neck, and I felt better, and I was fine that day. So I woke up the following day, and I had a really bad headache and some tightness in my chest. So I took an aspirin. The symptoms went away, and I was fine. But today I woke up and I had severe chest pain and dizziness and fatigue. So I was really concerned, so I came in.
Okay, well, I'm really glad you came in. Hopefully we can figure out what's causing all of this. And along with those symptoms, have you been experiencing any heart palpitations or abnormal heartbeats?
Not usually, but sometimes my heart rate gets elevated.
Okay. And what about swollen ankles? Have you noticed a difference in them at all?
No, not really.
Okay. So I'm going to move on to past history.
Okay.
So do you have any previous heart problems like murmurs or a history of MI at all?
I know that I've had a murmur since I was little, but it's never really affected me, so until now.
Okay. And people you saw, any doctors, have they said you needed anything?
They said when I was little I would, I wouldn't present any symptoms, but now that I'm older, I think it's starting to affect me a little bit more, so I'm concerned.
Okay. And do you have a history of rheumatic fever or hypertension?
I do have hypertension. I'm on anti-hypertensive meds. I usually take those as prescribed, so.
Okay, and what about diabetes?
No signs of diabetes.
Okay, and then elevated cholesterol?
Yes, I do have problems with my cholesterol. I take cholesterol medication as well.
Okay, that's good, and it's definitely good to keep up with the medication regimen just so everything tries to stay as normal as possible.
Mm-hmm.
And what about heart surgery or a cardiac balloon intervention?
No surgeries as of now.
Okay. And what about family history? Does anyone in your family have a history of hypertension?
My father, yes, he had high blood pressure as well as cholesterol and heart disease, so
Okay.
it kind of runs in the family.
Okay. And what about myocardial infarction?
No history.
Okay. And coronary heart disease?
Yes, my father.
Okay. And he also had elevated cholesterol, you said?
Yep.
And did he have diabetes?
No.
No. Okay. And now I'm going to go into your lifestyle practices.
Okay.
Are you a smoker?
Yes, I've smoked a pack a day for 25 years.
Okay.
Not really good, but I try to cut back, but it doesn't usually work because I'm really stressed, so I just smoke to relieve it.
Well, it's good you're trying to cut back. What about, other than work, do you have any really big stresses in your life?
Not really. I just work a lot, long hours. I have really intense projects that I need to get done, so I'm under a lot of stress usually.
And what about usual diet and exercise patterns?
I try to eat healthy, but I usually eat on the go, like fast food, or I don't really have time to cook because I work long hours to get my projects done, so I try, and I don't really have time to exercise either, so I don't usually.
Okay. And what about a sleep routine? Do you use any extra pillows, or do you notice yourself getting up in the middle of the night to urinate at all?
No.
Okay. And do you feel restless?
No, not at all.
No?
Just tired and fatigued.
Okay. And other than the medications you told me about before, is there any more?
No.
No? And then have you been self-monitoring your heart rate and blood pressure?
I mean, I try to, but I usually don't have time to do it. I just take my medicine and kind of hope for the best,
Okay.
but,
And screenings for blood pressure, do you go annually?
Yeah,
monthly?
usually at my physical they take my blood pressure, cholesterol, and do EKG just to make sure everything's going good.
Okay. And has anything with your heart impacted your sexual activity at all?
No, I'm not married, I'm not in a romantic relationship, so it doesn't really affect me in that way. So.
Okay. So thank you for your time. I'm going to go discuss with another nurse, and she will be in to do your physical assessment.
Okay, thank you.
Be right back. Hi, Becca.
Hi, what's up?
So I have this patient. She came in today. She has chest pain, and she was working on a project at work last week, and she started to feel really lightheaded and dizzy. She started really profusely sweating, and she thought it was kind of just due to the stress of work, so she kind of just didn't do anything about it, kept working. And then the next day she woke up with chest tightness and a headache. She took aspirin and the symptoms subsided, but this morning she woke up with excruciating chest pain, so she really thought she should come in and check it out.
Definitely.
So I was just hoping you could go and take a look at her and see maybe what's causing all of this.
Yeah, sure. Let me just take a look at her health history and I'll go and look it over. Okay, so I see that she is hypertensive, or has that been rechecked? Because I can recheck that.
I haven't checked.
Okay, so I'll just do that when I go in. She's a smoker, and her family does have the history of high cholesterol.
Yeah, and she also, when she was a child, diagnosed with a mitral valve prolapse.
Okay, so that could also be a big problem.
Definitely.
Okay, so I'll go in, I'll double check all of those, I'll grab some data, and I'll be back.
Perfect. Thank you so much.
You're welcome.
Come in.
Hi, Alex. I'm Becca. I'm going to be your second nurse giving you your head and neck assessment.
Okay.
Nice to meet you.
Nice to meet you too.
So I hear you've been having a little chest pain and stuff?
Yeah, like right in my chest.
Okay, we're going to try and get to the bottom of that. I'm going to start by taking your vital signs first. I hear you have high blood pressure.
Yeah, I do.
Double check that. At the same time, we're just going to take your temperature, preliminary. Okay. And it says your blood pressure is 160 over 90. Is that usually how high it is?
Yeah.
Okay. All right, so now I'm going to take your carotid arteries first, and then I'm going to palpate them to see if there's any abnormalities, okay?
Okay.
Gonna listen for breathe. Move your hair back, thank you. All right, now I'm going to palpate them one at a time. And now I'm going to look at your jugular veins. So I'm going to ask you to lay back onto the table.
Okay.
And first, I'm going to ask you to look that way. You're going to look for any distension, bulging. Okay. And then I'm going to do the other side now. Just look that way. Okay. And now I'm going to lay you further back onto the table, and I'm going to listen to your heart sounds, okay? Okay, so we're going to start by looking for your apical pulse, which is right on the side. So I'm just going to take a look over here. Just put your hands to the side, please. Okay, I'm just going to palpate, see if I can feel it. Okay, I can't feel it there, so can you just turn onto your left side for me? And just put your head up by your ear, or your arm up by your ear. Thank you. Feel it. Okay, all set. You can go back on your back. And now I'm going to listen to your heart sounds. I see that you're diagnosed with a mitral valve prolapse.
Yeah.
Okay, so that's going to be by your apex. So we're just going to figure that out, okay? Let's start with your aortic area. Going to move to your pulmonic. So sorry. Now down to Erb's point. Tricuspid area. And now the mitral area. Okay. And that is where your murmur is. It's down at the mitral area.
Okay.
Okay. I'm just going to write this down. So you can sit back up. And I'm going to go talk this over with Mackenzie. We'll be right back, and maybe we can have a diagnosis for you, okay?
Thank you.
Hey, Mackenzie. Hi. All right, so I was just talking to Alex. I did listen to her heart sounds, and she did have a mystolic click, which led to a late systolic click, and that does indicate the murmur that she has.
Okay.
when I was in there, she was sweating a lot. So there's definitely some diaphoresis going on. Her blood pressure is 160 over 90. She said that was normal, but still wicked high. Her temperature was 98, heart rate 110, respirations 24, and pulse ox 96, which is kind of low. So
Yeah, that is a little bit
nervous.
Mm-hmm.
So I looked over the patient history and I made some nursing diagnoses. First one was ineffective health maintenance related to stress, as evidenced by patients stating that she smokes a pack a day, neglects to check her heart rate and her pulse, her poor diet and lack of physical activity. And that also led to her now acute pain related to malfunctioning heart valve, as evidenced by patients stating chest pain, diaphoresis, evaluated blood pressure, and guarding. She was guarding a lot, holding her chest when she was in
when
there.
I was doing the interview, she was also doing that.
Yeah, so I think that she should definitely go see a nutritionist for her diet, a psychologist for her stress, and definitely a cardiologist for that murmur, because it really could be getting worse.
Right.
All right?
Sounds good.
I'll let
go
you do
talk
the
to
patient.
her.
Come in.
Hey, Alex.
Hi.
So I just talked to Becca about your condition, and we see that your doctor diagnosed you with a mitral valve prolapse, and we think that's why she was hearing the murmur sound of your heart, and it really wasn't sounding normal.
Do you know what that is exactly?
Yeah, so that's when your mitral valve is being swung back into your left atrium, and it's taking blood with it. So you really have a decreased blood output from your heart. So basically, your heart really has to work overtime to make sure your tissues are getting an adequate blood supply.
Oh, okay. Is that why I'm fatigued a lot?
Definitely, and that's probably why you're feeling a lot of chest pain too,
Mm-hmm.
just because it's really working overload.
Mhm.
So we diagnosed you with a few nursing diagnoses. We have acute pain related to malfunctioning valves, and also ineffective health maintenance related to stress, because it's hard when you're working all the time to really keep a healthy diet and everything. So because you're smoking and not eating healthy, not really exercising, have high cholesterol, hypertension, and also have a family history of CVD, we think you're really at risk for developing heart disease.
Yeah, definitely.
So we thought that referring you to a nutritionist would be really helpful. They can help maintain your diet, help you start exercising more, and like really fitting it into your work schedule. We would also refer you to a psychiatrist, because maybe talking with someone if you're feeling stressed out really might help, and hopefully will also help alleviate the symptoms that you're having.
Okay.
And also a cardiologist we want to refer you to, because he'll definitely look further into your chest pains and the heart murmur that you're having. He might suggest surgery to really help alleviate the pain that you're feeling and just fix the valve. So I think that will be really helpful. It's not definite yet, but he'll let you know for sure.
Okay, thank you.
So it was
Sounds
nice
good.
meeting you.
Nice meeting you too.
Hope everything goes well.
Thank you.